the chairman of the Department of Microbiology, and sir is also the president of HISI Aligarh. Sir, please.
Good afternoon, everyone, and Assalamu alaikum. I'm very pleased to be here for this World Hepatitis Day function. We always insist, even during your orientation programs, that hepatitis is one of those problems. I think we all should be very well aware of how to protect ourselves.
He is also the chairman of the Department of PBRD, JNMC. He has been the recipient of many prestigious awards, and sir has always been our supporter and has encouraged the organization of such events. So, sir, I'd like to invite you to say a few words.
Obviously, the organizers, especially Professor Haider Khan, Madam Fatima, as well as the student wing, I will congratulate you all in organizing this important topic for you, because as Dr. Haider has already said, the prevention is much better in these cases. It's better in all three diseases, but since viral diseases are such which are very difficult to treat, so prevention is very important in all hepatitis as well as all viral diseases. Now, new problem is again coming after the COVID, is that another viral infection. So all these things, you need basic things, basic infection prevention control measures, which vaccination is available for that.
For such enlightening words. Now I would like to invite our first speaker of the day, Dr. Hussain Haider sir, to deliver his session on hepatitis B virus, clinical course diagnosis and management.
Dean Professor Aligarh sir and Professor Haider Khan, respected medical superintendent, my colleagues, ladies and gentlemen, a very good afternoon to you all. My students frequently ask me that what should be their goals in life, what should be their ultimate aim. At the end of the day, what should they want to achieve in their lives? So I often answer in this way, that as the telescope, the Webb telescope of NASA has shown us, that you have to plan to reach the stars, no matter how far they are. That should be your target in life. No matter how difficult it is, you should always aim high and work hard in order to reach that target, because that is where your place is in the scheme of things. You were made to conquer, so never settle for anything less than that. Going to the next slide, my slide is, on this basis, the World Health Organization and the Government of India has come up with this concept of eradication of chronic hepatitis C by 2030, and by 2025 we plan to at least diagnose 60% of patients who are chronic hepatitis B positive, and at least 50% who are eligible to treat should be treated. For your information, we started since December 2021. Since then, we have recruited 194 patients of chronic hepatitis B and C, out of which 126 are hepatitis B and 68 are hepatitis C. And the National Viral Hepatitis Control Program in Lucknow is quite happy with our performance. So we hope to eradicate and fulfill our goals covering the entire Western UP by 2025. Now coming to hepatitis B, our learning objectives are simply, we are going to go through the natural history, the clinical signs and symptoms, and we try to identify at what stage the disease is, because that is how we are going to decide whom to treat or not. So there are almost 4 guidelines throughout the world that are being followed. There is the American Association of Study of Liver Disease 2018, then there is the European Advanced Study of Liver 2017, and there is the APASL, the Indian guideline, but the government of India has come up with a joint guideline in this form, so we are following this guideline. We'll come to that. Now, first of all, going to understand, there are 2 parts of the infection. One is the acute one is the chronic one. So, as you all know, the acute infection in more than 95% cases, it resolves by itself within a period of 6 months. So there is no problem there. There is no community spread. It is not a reservoir of infection. So most of the time, actually, by the time 3 months have passed, the patient already starts becoming negative, and at the end of 6 months, he becomes negative. But in 5% of cases, the patient goes on to become a chronically infected patient. That is, the HBsAg antigen persists for more than 6 months. So when the patient has acute viral hepatitis B, it can be an asymptomatic infection. It can represent as acute viral hepatitis, or it can present in a more morbid form, in the form of acute liver failure. Now, this is a cause for concern. Whereas in the chronic infection, you have chronic hepatitis B. It goes on to produce compensated liver cirrhosis, which goes on to produce decompensated liver cirrhosis, which goes on to produce hepatocellular carcinoma. So we will come through these stages to make you understand what is compensated, what is decompensated, and what is HCC. So as you can see in this graph, the most important thing by far in the epidemiology of chronic hepatitis B is the age of the patient when he gets infected. That by far is the most important cause. And the reason why this is so important, because look at the graph. Now at birth, if somebody is infected, how does he get infected? When the mother is infected and she vertically transmits the infection. Right now in India, we are supposed to be in the intermediate zone, that is our infection rate should be less than 7%. But the truth of the matter is, even the government of India has said that the range of HBsAg positivity in India is between 1.1% to 12.1%. So basically, nobody is trying to admit that we have a high caseload of chronic hepatitis B amongst us. But that is the truth. And the reason why is, the most common reason is vertical infections. Mothers are positive, they give birth to their children at home. Because that happens, the children are not given immunoglobulin at birth, they are not given vaccination for chronic hepatitis B. And then they transmit that infection. That is why you can see this is where the infection starts. And because a child doesn't have a robust immune system, the infection persists in the body, and by the time he's 40 years of age, he has already developed chronic hepatitis C and liver cirrhosis. I personally have seen many patients below the age of 20 coming with decompensated chronic liver disease because of hepatitis B and dying before the age of 20. So this is a very, very important part, that pregnant females should be tested for hepatitis B, and the child that is born should be vaccinated, and immunoglobulin should be given within 24 hours. So as you can see, an older age group, the positivity rate to chronic hepatitis C falls. So age by far is the most important criteria. Then from a public health point of view, like I said, acute hepatitis B is not a great cause of concern because it remits by itself. Whereas the chronic is a reservoir for infection, for spread. Secondly, the risk of morbidity increases because such a patient will develop liver cirrhosis. And you see, once liver cirrhosis becomes decompensated, the only curative treatment for that is orthotic liver transplantation, which costs at least 15 lakh rupees in India. No government college actively does liver transplantation. So once a patient needs liver transplantation, he has to go to a private hospital. 15 lakh rupees, he must have a donor, and zindagi bhar ke liye he has to remain on immunosuppressants. So it is not easy. Imagine a disease that is totally preventable by simply vaccinating yourselves. You will save all the trauma. Dekhiye, ek aur cheez maybe not mentioned it earlier. If you become Australia antigen positive, many countries will not allow you to practice in their country. They will not allow you to become a surgeon. If you are a surgeon, they won't allow you to hold a scalpel. If they allow you, then they'll get you through so many tests that most of the time you will be there without surgery. So what would a surgeon do without doing surgery in life? So please understand the importance of hepatitis B vaccination. If you are not vaccinated, kindly get yourself vaccinated, and you also need to get an anti-HBs titer done. So as you can see, HBV infection acquired during childhood is our primary concern. Anybody developing acute hepatitis B in adulthood, the chances are very, very high that he will recover with no problems. Now, I would stress on the acute part. The acute hepatitis B presents like most viral illnesses. There is a prodrome, there is an icterus phase, and there is a convalescence. 1 to 3 months, the illness persists. After 3 months, the person becomes asymptomatic. But up to 6 months, HBsAg antigen might persist. So once it crosses 6 months, then the patient becomes chronically infected. Now, acute liver failure. This is a complication of acute viral hepatitis B. Fortunately, it is not common. Here, the patient develops acute liver failure. That is, he goes into hepatic encephalopathy. He has coagulopathy, and here this is an indication for admission in the hospital, and is an indication for antiviral therapy as well. Otherwise, remember, acute viral hepatitis B may no antiviral therapy is indicated. Acute phase में the only situation where antiviral therapy is advised is when the patient goes into acute liver failure. Because the Indian guideline is more aggressive. We have studied all the guidelines in the world, and we are more aggressive, so we treat more patients. So we are on the other side. We don't want to fall short. Now, like I said, prodromal in the comparison of acute viral hepatitis and acute liver failure, the only difference would be encephalopathy, coagulation, and the liver size would become small. Once this happens, it means now your patient is actually very sick. So you have to admit the patient, you have to give conservative treatment, you have to give antiviral treatment, and in some patients you have to go for orthotic liver transplantation to save his life. Because this happens, patients also die because of acute liver failure. Now coming to chronic hepatitis B, you see this is it's a legendary Rani Lakshmi Bai against the British. It is all about the immunity of the body, how good the immune system is, and with respect to hepatitis B, it is the age group again that decides what will be the immune status of the patient. The younger the patient, the weaker the immune status. The truth is, the baby behind Rani Lakshmi Bai is more at risk of dying because of liver cirrhosis than the Rani herself. Because at this age, if he contracts the disease, he will later on decompensate earlier. She might survive with very little consequences. Now, these are the stages through which chronic hepatitis B passes. You see, I have been given a very big topic, so I have to rush through it because I have to go through up to treatment. So I will just hurry up. There are 5 phases: the immune tolerant phase, immune reactive phase, immune control phase, there's immune clearance, as well as the activation phase. मोटी मोटी बात समझने की ये है, 2 phases हैं. There's 1 phase of infection, 1 phase of inflammation. 1 phase of infection, 1 phase of inflammation. Inflammation का मतलब है transaminitis, ALT, AST बढ़ जाएगा. इसका मतलब है inflammation. ठीक है? Infection stage, inflammation stage. Inflammation का मतलब AST, ALT बढ़ जाएगा. याद रखने की बात यह है, you only treat a patient when he is in inflammation. बस. You don't treat a patient when he is in the infective stage. You treat the patient when he is in the inflammation stage. So the 2 inflammation stages are the immune reactive phase and the reactivation phase. तो आपसे कोई पूछे what is the stage at which antiviral therapy is advised? It is the immune active phase and it is the reactivation phase. So let's just go through it quickly. To understand, the immune tolerant phase is that phase where the patient is HBeAg positive. He is highly infectious. This is the infectious phase. Here there is no inflammation, only infection. So the HBV DNA levels are increased. As I said, there is no inflammation, only infection. So the ALT/AST is low. Okay? Now the next stage is the immune active phase. This is the phase of HBeAg inflammation. So now because there is inflammation, the HBV DNA is also high and the AST/ALT levels is also high. This is the stage where you have to treat the patient. The patient is in active hepatitis, means inflammation. So you treat him at this stage. Now the third stage is when the patient becomes, either the HBeAg becomes negative and anti-HBe arrives. Now this is the stage where the immune system of the patient is at maximum. Good immune status. When there is good immune status, HBeAg has disappeared, HBV DNA has disappeared. There is no inflammation. इसमें कुछ नहीं करना. You leave the patient. The last stage of reactivation. Here, the patient has flares of acute hepatitis B. On chronic hepatitis B, he has many flares. So there will be a rise in ALT-AST, there will be a rise in HBV DNA in between. This again is a stage of treatment. Now this is just to further explain that. First, let's see the immune control, the immune status of a patient. This is the time since infection. Now you can see at birth the immune system is very weak. By the time he is like 20 years old, it's at maximum. When it goes, he's around 40, 60, again the immunity falls. Second, see the viral load at the immune tolerant phase where he is infected, it is at maximum. It goes down, down, and around 20 years of age in between it goes low, and then it starts rising towards the end. Third is the stage of inflammation. So as I said, the first stage is of infection. Again, now ALT-AST becomes maximum. Now just to understand the phases. Phase 1, HBV DNA is high because it is infection. HBeAg is positive because there is infection, but there is no inflammation. AST-ALT is low. There is no hepatitis. Second stage, the immune active phase. Here the HBV DNA is high, the ALT-AST is high. The immune system is just there present. This is the immune active phase. This is the phase where treatment is prescribed. Third, the immune control phase. Now HBV DNA has become 0. The immune system is at maximum and the ALT-AST level is also falling. Here again you will not treat the patient. The last phase, the phase of reactivation. Here flares of hepatitis are present. HBV DNA is also present. So again here you will treat the patient. Now just to make you understand, like I said, the immune system of the body is strongest in the immune clearance phase. At immune tolerance it is weak, it is strong here and it becomes weak at reactivation again. Immune tolerant phase is a phase of infection, so the HBV DNA is high, the HBeAg is positive. There is no inflammation, so no treatment. The immune reactive phase, now the HBV DNA is moderate, HBeAg is present, and inflammation is present. So now you have to treat the patient. The immune clearance phase, the activity is moderate, HBV DNA is low, the immune system is strongest, so no treatment is needed. In reactivation again, even though this might be low to moderate, but there is active hepatitis. There are flares of hepatitis B here. That is why you have to treat this patient. You see, the biggest challenge in the treatment of hepatitis B is that most physicians are confused about the treatment. Because once you start the treatment, it is very difficult to actually stop the treatment because the goals that have been given to us are difficult to achieve. So the biggest challenge is to dawa shuru kisme karni hai. You see now, because the government of India has given us these drugs, so now we are providing these drugs for free. Varna 3600 rupees ka kharcha every month hai. For the drug, to buy Intacavir or Tenofovir, he has to spend that much money. Then the testing costs 3000 HBV DNA. Imagine every 3 months, 6 months, he had to spend that money. But now, under NBHCP, the treatment is free. The testing will also become free. We just need some time for that. It's work in progress. So see, this is the way it goes. Prolonged chronic HBV infection goes on to produce liver cirrhosis, which goes on to produce hepatocellular carcinoma. So this is what we need to prevent. Now, untreated patients of chronic hepatitis B show a cumulative risk of 8 to 20% to develop cirrhosis over a period of 5 years. So you see, that is why chronic hepatitis B has to be prevented. This is why, because 20% is a very high figure. 20% of, imagine 12% of the data hai that 1.1 to 12% of the Indian population is HBsAg positive. Let's go with the higher figure. 12% में अगर 20% को cirrhosis हो गई in the next 5 years, तो कितना नुकसान हो जाएगा? It's a huge population. Now, advanced liver disease presents an extensive fibrosis and liver nodularity. That is what advanced stage liver disease means. Now, hepatitis B will decompensate every year. Imagine, out of all the livers, 20%, 1/5 of them will decompensate. Now, decompensation, like I said, means ascites, hepatic encephalopathy, coagulopathy, variceal bleeding. Once that happens, it means your patient is decompensated. And once he becomes decompensated, his mortality rate increases to 50% within 2 years. तो मैं आपको मोटी सी बात बता दूं, जो पेशेंट्स आप लोग हमारे वार्ड में एडमिट करके आपको दिए जाते हैं फॉर असाइटिस, आप कहते हैं कि हर बार असाइटिस दे दिया हमें, please remember, it's very highly likely that you will not see that patient again because he is going to die within 2 years. 50%, he has a 50% chance of dying within 2 years. So this is how bad decompensated liver disease is. Now just to summarize, children are the age group less than 5 years of age who suffer most from the infection. Then in 90 to 95% of cases, acute hepatitis B recedes, nothing happens. Chronic hepatitis B passes through several stages. I will explain the stages to you. There is a stage of decompensation and compensation. Liver cancer can occur without liver cirrhosis. Remember that. Now just go through the management. Just 2-3 slides. Treatment needed. Now just remember. Now this is how you treat your population. The first test you do is an Australia antigen, HBsAg positive, HBsAg negative. Now, if your patient is HBsAg negative, he is not hepatitis B positive, he doesn't require treatment at all. If he is HBsAg positive, you look whether he is serotic or non-serotic. Non-serotic can be done by ultrasound or you do a APRI test. It's a formula based on the AST level and platelet count. You just put it in the calculator and the answer would come out. If the score is more than 1.5, it means the patient has severe fibrosis. If the score is more than 2, it means he has liver cirrhosis. So now once your patient has developed liver cirrhosis, he has to be treated. It doesn't matter what his ALT level is or what his HBV DNA level. It is immaterial. Once he has developed liver cirrhosis, you have to treat the patient with antiviral drugs for life. Second, if you are talking of non-serotic patients, then you see whether the ALT level is persistently elevated or it is normal. Persistently elevated means ALT should be 2 times high. The test should be repeated 2 times 1 month apart in the last 6 months. पिछले 6 महीने के अंदर आपने 2 बार LFT कराया उसका, दोनों बार उसका जो ALT था वो more than 2 times high था. This is known as persistently elevated LFT. If your patient is non-serotic, the patient is persistently elevated ALT, and the HBV DNA is more than 20,000 per international units, then you have to treat your patient. ठीक है? Non-serotic, अगर serotic है तो उसको treat करना ही है. It doesn't matter what is ALT, what is HBV DNA is. If it is non-serotic, you go for the ALT. If it is more than 2 times elevated, 2 times 1 month apart in the last 6 months, you go for HBV DNA level. If it is more than 20,000, you start treatment. Okay? Now this is a little different because this is from WHO. It's a little different from what we are doing. We are more aggressive in our management. If your patient is non-serotic and has less than 20,000, treatment इसमें deferred लिखा है. But what we are doing is, if his APRI score is 1.5, which means severe fibrosis, or his platelet count is less than 1 lakh, meaning he is developing portal hypertension, then we prescribe antiviral therapy. Likewise, if the ALT level is normal in this patient, he is non-serotic, and his HBV DNA level is more than 2,000, even then we do the same. The APRI score of more than 1.5 or platelet count less than 1 lakh, we treat the patient. So we are aggressively treating patients now. So please, if you know any person who is HBsAg positive, you send him to us because we need to register these patients. And this person requires no treatment. That's about it. I will just show you a few A dividing. Tenofovir is available, entecavir is available. Here again, and entecavir 0.5 milligram dose is given in compensated liver disease. 1 milligram is given in decompensated liver disease. Tenofovir alphanamide is not available to us, an expensive drug. It is only indicated in CKD patients who have chronic kidney disease. That is not available by the government of India. This patient has to purchase. And in children, the age group, you don't treat patients below the age of 2. So only 2 to 12 years, the age group you treat. If the child is above 2 years, you give him entecavir according to his weight. If he is more than 12 years of age, you give him tenofovir. So all patients have to be treated this way. And just say some particular cases, women of childbearing age or who are pregnant, tenofovir is preferred. Entecavir is preferred where in children between 2 to 11 years, like I said. tenofovir is preferred to patients who have been exposed to lamivudine. See, that's all. And 60 years of age group, entecavir is preferred over tenofovir. And I'll end my talk right here. But imagine all of this is very, very easily preventable if you all yourself vaccinated and get all people you know vaccinated, because the more people would be vaccinated, the less we will have to struggle through this debilitating disease which ends in a lot of agony for everybody. Thank you very much.